What's going on? Dr. Chad with Energy Physio. I want to talk for just a second about manual therapy. Okay. So if a joint's not moving well, something inside the joint's not moving well, it will limit your motion and it can create pain. So just conceptually, if something is sticky and not moving well inside of a joint, you're not necessarily going to be able to move your way out of that problem. You need to create new space in the joint so that normal motion can happen. And so when we're thinking about manual therapy as it relates to physical therapy and what's out in the marketplace, there are some who will say manual therapy doesn't work. So first and foremost, if that's your experience, I apologize. It works really well for us. And I think the key is you can't just mobilize to mobilize, okay? You have to use it after you create it, because if you don't use it, you lose it, okay? So if you create new space in a joint, and then you go use that new space over and over and over again, you are going to keep the new motion that you created. So what manual therapy is not doing is trying to create new motion. What manual therapy does is it creates space inside the joint so that normal motion can happen, okay? We're not trying to stretch a joint into a certain position and create new motion. We're just simply trying to create the space that should be normal inside the joint so your normal motion can happen. All right, so we're gonna look at the knee today. The knee is pretty complex, okay? Most people think it just goes up and down. There's actually rotation in there. You've got the femur on top, the tibia on bottom, but inside the joint, you've got the meniscus, and these are largely associated with the rotation of the knee. And so what we're going to look at is something that's pretty common in the knee, which is pain right on this front kind of inside corner. So you can see on my knee, it's going to be right here. And I'm going to draw this on the lateral knee because it makes it easier to see. Just know it's a direct reflection of the inside of the knee and how everything is shaped there as well. So a lot of times what we see is that when people straighten the knee, they have pain right here in this kind of front right corner. Now, there are a couple ways to think about that. You know, certainly it could be patellar tendon. That's not super common with just passive extension, more active. So if we have pain and it's passive right here, and the pain is right here in this little pocket, really that rules out almost everything except the front of the medial meniscus, okay? Now, there's some certain styles of manual therapy that can address this. We can't really just force, because if the meniscus is stuck, then it's just gonna keep pinching down on that spot right there. So what we need to do is get the meniscus moving forwards as the knee starts to move this way. So a couple of basic concepts is, as the knee is moving into a straighter position, it is rolling and sliding in the forwards direction, okay? Now, when that's active, what's happening is the quads actually have attachments to the front of the meniscus, so when it contracts, it actually pulls the meniscus forwards. These are very small connections. But if the meniscus is stuck, as it pulls into extension, it will pinch the front of the meniscus between the bottom of the femur and the top of the meniscus as that joint space closes down. So what we want to do is actually create a scenario where we can push the meniscus forwards repeatedly until we can minimize this pain into extension. So a couple of ways that we do that is we can get the knee. We always want to work at the range that is closest to the limitation, right? So let's pretend that right about here is where the knee starts getting sticky. We want to work here, okay? We might need to come up higher than that for somebody who's really sticky. We might need to go down lower than that for somebody who has a little better motion and starts to get pinchy further into extension. But let's say it's right here. We can block the femur, and then we can start to drive the tibia downwards, all right? So you really want to push until you take all the slack out of the hamstring, and then we're really just creating a glide in the tibia. And this is just straight down, okay? Following the joint line. So what I want you to see here is in this position, we're going to call this the top of the tibia, okay? And what we've got here is the meniscus, which is going to be shaped we'll say in the front, we'll say a shape like this. And this would actually continue on around outside, and that taper actually goes into the joint. But so you can see what we're looking at. We've got this right here, and then we've got the cam of the femur that actually comes down here like this, okay, and then continues up this way. So as we drive the tibia downwards, it's going to push the meniscus onto the front of the femur and create a little bit of forward pressure this way, okay, on that anterior meniscus. And not only does it stretch the capsule if that's stiff in the knee, but it also creates an effect on this meniscus. Now, what we can also do is bias an external rotation right here that can create more force on the meniscus on the front of the femur and drive that forwards. And just so you know, if for the inside, we would actually be creating internal rotation in this position to affect the inner side of the knee. Just want you to see what that looks like here. So that's one way where we can work towards the end range of extension and start to see what effect we get. Now, we always want to test, okay, it's sticky, do some work, and then can we get better extension in this position? And if the answer is yes, we want to work that until we run out of like new motion or less pain, right? So, but that's not the final step, because there's one more place we can go to create change here once we stop getting results in this position. And now it's kind of a backwards way of thinking, but when we stop getting results at the end range of extension, we can pick up more extension with less pain if we go into flexion. Okay, so now you can see the relationship here is a little bit different. It's almost like the front of the meniscus is a little more exposed with a little more direct relationship to the femur, all right? And so now if we drive the tibia backwards, it's running into the femur sooner and more directly and create more forwards pressure on the meniscus to get it moving. And now, these are small motions, okay, but they're significant when we start moving down into extension. So same thing, we can do, and imagine this, the shape's a little different once we move here. But if you drive the tibia straight backwards, you can conceptualize how the femur is going to hit the meniscus and give it a little bit of pressure towards the front. Same thing though, we can bias external rotation here at the tibia on the femur. That would create an effect on the lateral meniscus. For the medial meniscus, we would create an internal rotation to accomplish the same thing on the other side of the leg. And then we're going to work that for a little bit. We're going to keep driving it in and working it some more, drive it in and work it some more until we've really kind of milked all the results we can get out of there. And then same thing, we want to bring it back down and test it. And 100% of the time when we do that, they get better extension with less pain after working the knee in flexion by creating some of that new space in the front of the knee, okay? So we didn't put her knee in a position and force it into the position we want to take. We actually thought with a little higher level of biomechanics and using the anatomy and the shapes and the relationships to our advantage, by moving it into a different position, we didn't just force the knee into the position we're trying to get it into. We created space within the joint that allowed the new motion to happen, right? And this is the core foundation of manual therapy. Don't think manual therapy is push the joint into the position and hold it there until it can go there. It's a painful way to go. It's a slow way to go, okay? Use the biomechanics to your advantage. Start to maneuver those things in a way that creates space in the joint that allows the normal motion to happen. It's faster, it's less painful almost every single time. And this was a representation of the knee right here. But you can do this on the shoulder, the knee, the hip. If it has a joint and a joint capsule and pretty much any joint in the body, you can work that joint in a specific way that creates new space that allows normal motion to happen. So if you're struggling with pain in the front of your knee, okay, there are ways that you can do this to yourself. We can create space in the knee. Allow things to move better inside the joint so that your normal motion can happen. Same thing goes for the ankle, the hips, the shoulders, elbows, wrists. There are ways that you can do any of this stuff on your own. So if you're looking for some solutions, maybe you've been to therapy, been to chiropractics, maybe taken some injections, you're still having the same pain, there's a good chance that your joint is just not functioning like it should. Now, there are lots of reasons for that, but right now, let's just focus on, can we create some change in your joint to help you get better motion and less pain right there at the joint with some simple kind of do-it-yourself strategies. So if you're looking for something like that, drop us a DM. Freedom's a good one. Just say freedom. Say, I've got some knee pain, help me out. Just reach out to us and we're happy to connect you with some do-it-yourself solutions to create not just more normalcy in the knee, but if you're struggling with any joint, let us know. We'll see you later.